First of all, congratulations. This is the kind of event which doesn't happen in London, although there's a clear need for such intercommunicating conversation among housing providers such as they are, the health service, and parts of government in London. So congratulations. And thanks very much to my former colleague at the Royal Commission, Zoe Tunderwood-S, and others for making it happen. Although I'm not a full-time journalist, I'm going to revert to type, however, and very briefly be a party pooper and say in very cartoon terms a number of, I hope, provocative things, which, based on evidence, not necessarily, which will allow you to come back. So, the question we're posed, how can we get better at creating places that support health? The truncated answer is get rid of the anti-collectivist ideology which rules our politics at the moment. Whether that means getting rid of the Cameron government, I leave you to judge. How important is the built environment to our health? Beware environmental determinism. Clearly, income and market position are more determinative of health outcomes, the evidence shows, than any intermediate variable. We see with education, a good analogy. Schools, important as they are far less important than family background and particularly family income in determining, not in individual instances obviously, but in collective terms, the outcome of children in terms of life chances and opportunity. By analogy, the same position in terms of your likelihood of falling ill and dying, as it were, prematurely. We have to, Marcus sort of admitted this, housing supply and tenure matter more at the moment than design. As we speak, major changes in the pattern of tenure are taking place, which will necessarily have consequences for health and well-being. Just very briefly, the private rented sector, we all know, has been growing remarkably, now houses 19% of all households in England. The proportion of those in the age when they might be having children, that's to say between, let's say, the late 20s and early 40s, living in private rented accommodation is growing rapidly. And the likelihood is, given the nature of that accommodation, that the conditions into which those children will be born will be, in general, less conducive to their well-being in aggregate and their healthfulness over a life course than were they living in more controlled, in a family sense, environment. Given that much of the accommodation in the private rented sector is going to be provided now by buy-to-let landlords whose principal interest is return on capital, not quality of life for their tenants. Jane rightly said, we live in the age of evidence. The evidence is quite clear. It can identify obesogenic environments. It points to opportunities and their impact on health and well-being of travel, cycling, walking we've heard about, the consequences for certain kinds of mobility, diabetes too, etc., is well established. There need be no argument about linking what we know about housing and physical activity and the likelihood of contracting life-inhibiting conditions. But the big variable is the political will and the mobilised resource to do anything about the circumstances. I wear on my wrist, because I'm of that age, a Fitbit, and clearly this symbolises the individualist approach. We can choose to walk if we come from backgrounds and have income that allow us to make that. Most of the considerations we're addressing today rely upon collective mobilisation, and I'm just briefly going to say, forgive me, it's going to be political, but it seems to me there is no alternative to that. We live in an age where markets have triumphed. Housing has become marketised. This autumn, the capacity of social landlords, non-profit social landlords, to deliver has, with their own acquiescence, been reduced in a major way. The being of housing associations as the potential providers of healthful accommodation at all age levels, their participation in dialogues like this is going to be severely reduced as they reduce their affordable stock and become effectively simulacra of private developers. I grew up in a new town in which the state, in the shape of a development corporation, was able, in a sense, to create community, and community then enhanced the life of a government-provided housing environment with all the green spaces that the 1950s generation of new towns gave. No longer, in present political ideological circumstances, is such a thing possible. There's been talk, which hasn't been delivered by the present government, the coalition government also, of private sector new towns. Don't hold your breath. The private sector's interest in amenity is severely conditioned by opportunities for profit. The FT today announces that Taylor Wimpey, among developers, is doing very well. It's announced unexpectedly high rates of profit. Taylor Wimpey may be a good or a bad developer, but its interest in healthful environments comes second, if it has it at all, comes second to its observation of its shareholders' interests. So what I'm saying is, if the question again is how we get development sites to be purchased and made available for the entry of small providers, small businesses we talked about over lunch, or others into housing, that will depend upon the financial fiscal capacity of local government. And I needn't tell those of you who are involved with British City Council or with the NHS here that municipal capacity is severely constrained relative to 2010. Next week we'll hear George Osborne announce his spending review, which will further cut the capacity of local government. So when you hear him, and he may be sincere about the Northern Powerhouse and city regions, when you hear him talking about the potential of local government to become more involved as a provider of infrastructure, ask the pounds, shillings and pence question. Where is the resource going to come? Given that we know this government doesn't actually believe that local government should be a major player in the provision of social welfare services, which, for our purposes, include housing. So I'm afraid I'm leaving you with a crude message, which is it is, yes, ultimately all political. Austerity could end. Austerity is not a necessity. It's a political choice. We live with a government which has a fixed view about where the state should be and the size of the state should be. The state is a necessary actor in all of the projects that we're talking about this lunchtime. And again, I have to leave you with an even more unwelcome thought. The state's capacity in turn depends upon our willingness to be taxed. The people in this room may be willing to pay income tax, but it is the case that UK levels of income tax are well below those registered in other continental European countries, the Netherlands, Scandinavia, Germany, where people are willing to pay in various kinds more tax. And so the capacity of the state, federal government, local, municipal and regional government to do more on linking housing and well-being is the greater.
Thanks, David. Thank you.